How do you interpret fecal calprotectin for IBD flares? Imagine trying to catch a signal from your gut to see if it's inflamed. Fecal calprotectin is like a tiny messenger that tells us what's happening inside your intestines. It's a protein released by white blood cells called neutrophils when there's inflammation. When your gut is inflamed during an inflammatory bowel disease flare, these neutrophils rush to the area and releases calprotectin, which ends up in your stool. Measuring how much calprotectin is in your stool helps doctors see if your intestines are inflamed or not. If your fecal calprotectin level is below 50 micrograms per gram of stool, it usually means there's no significant inflammation happening. That's a good sign that your IBD might be quiet or in remission. But if the level jumps above 250 micrograms per gram, it's a sign that your disease is active and inflamed. This means your doctor might want to adjust your treatment or keep a closer eye on your symptoms. Levels between 50 and 250 micrograms per gram are a bit trickier. They suggest some inflammation, but it could be mild or caused by other factors like infections or diet. Your doctor will look at your symptoms and other tests to interpret these numbers properly. In inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, high calprotectin levels mean your immune system is reacting strongly in your gut. This helps distinguish between an IBD flare and other issues like irritable bowel syndrome, which usually doesn't cause elevated calprotectin. But remember, infections and other inflammatory conditions can also raise these levels, so it's not a perfect test on its own. For people with sensitive stomachs, irritable bowel syndrome, or colitis, fecal calprotectin testing is a simple, non-invasive way to check if inflammation is present. It helps decide if symptoms like diarrhea or stomach pain are from an IBD flare or just a functional disorder. This can guide your doctor on whether you need more aggressive treatment or just some lifestyle adjustments. You can use fecal calprotectin to see if your inflammation is improving with treatment or if it's getting worse. If your levels go down after starting medication, that's a good sign your treatment is working. Rising levels after a period of remission can warn of an upcoming flare, so your doctor can step in early. It's also helpful to decide if you need further tests like a colonoscopy. Keep in mind, while fecal calprotectin is a helpful marker, it's not specific only to IBD. Other causes like infections can also elevate it. So, your doctor will always consider your symptoms, medical history, and other tests when interpreting the results. This way, managing IBD flares becomes more precise, helping you stay as comfortable and healthy as possible.